From the beginning, the patients told us that the transition was seamless to them.
It means that they care about their patients. When you find physicians that take up the time that they have done with me, it's all about caring. Everything they find I need, I got it. And I'm just so happy for it.
The move to the lake has really provided us with a lot of resources to take better care of our patients. I think through that it's really enhanced the learning opportunities and the learning experience that we have as residents.
Our Lady of the Lake's role in the public-private partnership was to really assume responsibility for the graduate medical education programs, the LSU programs that were Baton Rouge based. We're going to transfer to Our Lady of the Lake, and with that, many of the inpatients that they care for. So it was our responsibility to create excess capacity, additional inpatient beds, and to begin our work on our Level 1 Trauma Center. As the negotiations continued, and really just a few months prior to the anticipated go-live, we were asked to assume a greater responsibility by taking on the operations of all of the network of clinics throughout the community.
Our negotiating team was consisting of all physicians. We kept the lawyers out of the equation. We didn't even talk about any financial implication. It was really about culturally, can our medical staff work in concert with the LSU faculty physicians and really begin transitioning into this major academic teaching hospital model. And we talked about big rocks. What are the big rocks in the road? And after about 6 months, we recognized that the fit was there.
Over the last 10 years, the LSU Collaborative is just one of the things that has been a part of our growth strategy as we continue to grow. If you think about our Livingston campus, our urgent care clinics in LSU Health Baton Rouge, we've grown our children's services. We are a Level 2 trauma center on our path to be a Level 1, which is part of the CEA commitment. Our partnership with Mary Bird Perkins and our growing cancer program, beautiful new infusion services and diagnostics dedicated to cancer patients. The Heart Institute has won a national award for design for critical care patients, and so we continue to look for creative and innovative ways to assure that we're the best place for patient care, both on the inpatient and outpatient side in Louisiana and beyond.
We're improving existing services, and we're adding new services that we didn't have in the past, including a second urgent care location. We've expanded our social services department and our case management departments, and we're really excited about adding a disease management program. Our patients will benefit through a more proactive approach to their care.
The ultimate goal, in my opinion, is to have a situation where we don't really need urgent care as much as we do now, because patients have a relationship with a physician and they're getting all that they need through that. It's fairly lofty, but I think something to look forward to, and so the more we can build that infrastructure, we will. I think some of the case management things we talked about are also a part of a goal, just having a more robust system and also being able to track outcomes over time. So right now we're kind of in the early stages of having a work queue and understanding who's high risk, moderate risk, low risk, but we want to over time and longitudinally be able to see how have we improved the health outcomes of those patients individually as well as communities or specific disease processes. So sometimes having wraparound services such as social work, access to and connecting patients to maybe shelter or food bank or other just basic needs is a lot of what we need to do to help contribute to health. And so I think we'll have a lot of activity related to that as we continue.
I'm so excited about the future of Our Lady of the Lake. I think through the advancements of all the things we have on the plate and what we anticipate going forward, I know we're well recognized in the state of Louisiana, but we're starting to feel a little bit of that heavy recognition outside of the state, more on a national stage of really what does a great academic medical center really needs to look like, feel like, and more importantly, act like according to the clinical quality of care and patient safety we provide each and every day.